Atherosclerosis and cardiovascular disease. 1. Atherosclerosis and cardiovascular disease take a huge toll on our society. More than 81 million Americans suffer from some form of cardiovascular disease, making it the leading cause of death in the country. As of 2006, cardiovascular disease was responsible for at least 1 in every 2.9 deaths in the United States. American Heart Association, Heart Disease and Stroke Statistics 2010. Despite the fact that cardiovascular disease is the single most deadly disease in the United States, most individuals, including most mainstream physicians, have a flawed fundamental understanding of the disease. The fact is, long before any symptoms are clinically evident, vascular disease begins as a malfunction of specialized cells that line our arteries. These cells, called endothelial cells, are the key to atherosclerosis, and underlying endothelial dysfunction is the central feature of this dreaded disease. Not every person who suffers from atherosclerosis presents with the risk factors commonly associated with the condition, such as elevated cholesterol, but every single person with atherosclerosis has endothelial dysfunction. Aging humans are faced with an onslaught of atherogenic risk factors that, over time, contribute to endothelial dysfunction and the development of atherosclerosis. Maturing individuals must address all of the underlying factors that contribute to endothelial dysfunction if they are striving to protect themselves from the ravages of vascular disease. Regrettably, mainstream medicine has failed to identify and correct all of the cardiovascular disease risk factors. This means that people wishing to stave off atherosclerosis must take matters into their own hands to ensure that all underlying causes are effectively neutralized. In the antiquated view of mainstream medicine, blood vessels have been thought of as stiff pipes that gradually become clogged with excess cholesterol circulating in the bloodstream. The solution that physicians recommend most often is cholesterol-lowering drugs, which target only a very small number of the numerous factors that contribute to cardiovascular disease. Conventional medicine's preferred method of re-establishing blood flow in clogged vessels is through surgery, coronary artery bypass graft surgery, or by insertion of catheters bearing tiny balloons that crush the plaque deposits against the arterial walls, angioplasty, followed by the implantation of tiny mesh tubes, stents, to keep the blood vessels open. However, the grafts used to re-establish blood flow often develop plaque deposits themselves. The same was true for balloon angioplasty. In their early years, up to half of all angioplasty procedures failed when the arteries gradually closed again. Even today, with the use of improved stents, the failure rate is considerable and many people have to undergo repeat angioplasty or even surgery. Mainstream medicine overlooks proven alternative to coronary stents and bypass surgery, enhanced external counterpulsation, EECP. Stable coronary artery disease and angina can cause disabling symptoms including shortness of breath, pressure or discomfort in the chest, exercise intolerance, and fatigue. A safe, effective, non-invasive therapy for the symptoms of coronary artery disease and angina is now available. Enhanced external counterpulsation, EECP, alleviates cardiac symptoms by enhancing coronary collateral circulation, alternate pathways by which blood can reach the heart muscle. The procedure is performed in a series of outpatient treatments, in which inflatable cuffs wrapped around the legs inflate and deflate in rhythm with the patient's heartbeat. More than 100 published studies show that ECP can effectively relieve symptoms of heart failure, increase exercise tolerance, reduce reliance on medication, and improve quality of life. Benefits of treatment can last up to 5 years. This novel therapy simulates the circulatory benefits of exercise, allowing patients to overcome symptoms and resume a healthy, active lifestyle. Atherosclerosis and cardiovascular disease. 2. Endothelial dysfunction, the underlying cause of all vascular diseases. The cause and progression of vascular disease is intimately related to the health of the inner arterial wall. Blood vessels are composed of 3 layers. The outer layer is mostly connective tissue and provides structure to the layers beneath. The middle layer is smooth muscle. It contracts and dilates to control blood flow and maintain blood pressure. The inner lining consists of a thin layer of endothelial cells, the endothelium, which provides a smooth, protective surface. Endothelial cells prevent toxic, blood-borne substances from penetrating the smooth muscle of the blood vessel. However, as we age, a barrage of atherogenic factors, if left unchecked, damages the delicate endothelial cells. This damage leads to endothelial dysfunction and ultimately allows lipids and toxins to penetrate the endothelial layer and enter the smooth muscle cells. This results in the initiation of an oxidative and inflammatory cascade that culminates in the development of plaque deposits. Subsequently, these plaques begin to calcify and, over time, become prone to rupture. If a plaque deposit ruptures, the result is oftentimes a deadly blood clot. If people do not take steps to correct the endothelial dysfunction occurring in their aging bodies, the consequence will be a worsening of the epidemic of arterial disease that currently kills 35% of Americans and 30% of all people worldwide. American Heart Association, Heart Disease and Stroke Statistics 2010. Sadly, mainstream medicine continuously fails patients by prescribing drugs that address only a very small number of risk factors that contribute to the pathogenesis of vascular disease. Numerous factors that directly contribute to endothelial dysfunction have been identified, and aging individuals can easily assess their risk for vascular disease through blood testing. The results of those blood tests can then be used to develop targeted intervention strategies to modify levels of risk factors that do not fall within an optimal range. Atherogenic factors that all aging individuals must be aware of include elevated LDL cholesterol. LDL is dangerous because it can penetrate the endothelial wall and contribute to the creation of foam cells, which form the core of a plaque deposit. Oxidized LDL cholesterol, LDL that has been exposed to free radicals within the endothelium, also triggers an inflammatory process that accelerates vascular disease. Life Extension recommends keeping LDL cholesterol levels below 80 mg/dl. Low HDL cholesterol. HDL protects against vascular disease by transporting cholesterol from the blood vessel wall back to the liver for disposal through a process known as reverse cholesterol transport. If HDL levels are low, then reverse cholesterol transport becomes inefficient, allowing for increased accumulation of cholesterol in the vessel wall. HDL levels of at least 50 to 60 mg/dl are recommended for optimal vascular protection. Elevated triglycerides. Triglycerides interact with LDL cholesterol to form a particularly dangerous subtype of LDL known as small dense LDL. Small dense LDL particles penetrate the endothelial layer and contribute to plaque formation much more efficiently than larger, more buoyant LDL particles. Keeping fasting triglycerides below 80 mg/dl to limit the formation of small dense LDL particles. Oxidized LDL. The oxidation of LDL results in severe vascular damage. Many studies show that oxidized LDL contributes to the entire atherogenic process from start to finish. Matsuura 2008. Levels of oxidized LDL can be assessed via blood testing. Hypertension. High blood pressure is known to aggravate endothelial dysfunction, and leading researchers have identified the endothelium as an end organ for damage caused by high blood pressure. A target is optimal blood pressure of 115/75 of a millimeter of mercury, or lower. Elevated C-reactive protein. Inflammation is central to the endothelial dysfunction that underlies vascular disease. An effective way to measure inflammation is through a high-sensitivity C-reactive protein, CRP, blood test. Studies have shown that higher levels of CRP are associated with increased risk of stroke, heart attack, and peripheral vascular disease. Stroke patients with the highest CRP levels are 2 to 3 times more likely to die or experience a new vascular event within a year than are patients with the lowest levels. Elevated LPPLA2. Like CRP, LPPLA2 is a marker of inflammation. However, LPPLA2 is a much more specific measure of vascular inflammation than CRP. LPPLA2 is an enzyme secreted by inflamed vascular plaque. Thus the quantity of it in circulation correlates with the amount of inflamed plaque in the blood vessels. Levels of LPPLA2 above 200 nanograms per milliliter are indicative of heightened levels of vascular plaque buildup. Elevated glucose. High circulating levels of blood glucose and insulin cause microvascular damage that accelerates the atherogenic process, partly by contributing to endothelial dysfunction. It has been shown that a fasting blood glucose level of greater than 85 mg/dl significantly increases risk of cardiovascular-related mortality. Excess insulin. As we age, we lose our ability to utilize insulin to effectively drive blood glucose into energy-producing cells. As glucose levels rise in the blood, the pancreas compensates by producing more insulin. As insulin resistance worsens, even more insulin is secreted in an attempt to restore glucose control. Excess insulin is associated with a significantly greater risk of heart disease. Venora, 2007, keeping fasting insulin below 5 mCu per milliliter. Elevated homocysteine. High homocysteine levels damage endothelial cells and contribute to the initial pathogenesis vascular disease. Homocysteine levels are associated with risk of heart disease. To keep homocysteine-induced endothelial damage to a minimum, levels of homocysteine should be kept below 8 micromoles/L. Elevated fibrinogen. When a blood clot forms, fibrinogen is converted to fibrin, which forms the structural matrix of a blood clot. Fibrinogen also facilitates platelet adherence to endothelial cells. People with high levels of fibrinogen are more than twice as likely to die of a heart attack or stroke as people with normal fibrinogen levels. Insufficient vitamin D. Vitamin D protects against vascular disease via several different mechanisms, including reducing chronic inflammatory reactions that contribute to the pathology of the disease. It has been shown that low vitamin D levels are associated with increased cardiovascular mortality. Maintaining a 25-hydroxy-vitamin D blood level of 50 to 80 nanograms per milliliter. Insufficient vitamin K. Vitamin K is essential for regulating proteins in the body that direct calcium to the bones and keep it out of the arterial wall. Low vitamin K status predisposes aging humans to vascular calcification, chronic inflammation, and sharply higher heart attack risks. Vitamin K blood tests assess levels of vitamin K to maintain healthy coagulation, but at this time are not used to identify optimal levels to reduce heart attack risk. However, there is a substantial amount of evidence that suggests that supplementation with vitamin K, as K1, MK4 and MK7, easily corrects the vitamin K deficits that are so common among Americans today. Low testosterone and excess estrogen, in men. Numerous studies link low testosterone, and excess estradiol, with increased heart attack and stroke risk. Testosterone is intimately involved in the reverse cholesterol transport process, which removes cholesterol from the arterial wall by HDL. Excess estrogen is linked with higher C-reactive protein and a greater propensity for abnormal blood clots to form in arteries, causing a sudden heart attack or stroke. Men should keep their free testosterone in a range of 20 to 25 pg per milliliter and their estradiol levels between 20 to 30 pg per milliliter. Insufficient CoQ10. Supplemental CoQ10 alters the pathology of vascular diseases and has the potential for prevention of vascular disease through the inhibition of LDL cholesterol oxidation and by the maintenance of optimal cellular and mitochondrial function throughout the ravages of time and internal and external stresses. Nitric oxide deficit. Nitric oxide is an important messenger molecule required for healthy cardiovascular function. Nitric oxide enables blood vessels to expand and contract with youthful elasticity and is vital to maintaining the structural integrity of the endothelium, thus protecting against vascular disease.